Hello, my name is Dr. Lochala. I serve Unity Health as Chief Medical Officer, and I'm honored to be here this morning with Ms. Julie Pate. Julie is a longtime registered nurse at Unity Health. She has served in the hospital for 15 years and then served for the last 5 or 6 years with Dr. Durham in the cardiology clinic. And I'd like to spend some time today getting to know Julie and her role as a nurse at Unity Health. Can you describe that a little bit?
Sure. So when I first started as a nurse, when I graduated college back in 2000, I started at the hospital on the cardiac step-down floor when it was just really open to only 6 to 12 patients. I was a staff nurse there, night shift to day shift, for about 3 years, and then I took the charge nurse role there, where I continued to do that until Dr. Durham asked me to be her nurse, and then I moved over to the clinic to work with her. Nursing to me has always been just about taking care of people, and I want people to be taken care of like I would want my family and friends taken care of. So I've always dedicated that part of me to that, as far as just really taking care of a person holistically, loving them as they would want their families taken care of. So it's been a pleasure to do that.
Yeah, and there's so much training that you've gone through to get where you are. Can you describe that a little bit?
Yes. I got my bachelor's degree in science and nursing from UCA in Conway, and then when I started at the hospital, we did some classes there, EKG interpretation, class at the hospital just specific to cardiology, and then also to work as I've worked, I've got my CPR accreditation, and I've kept ACLS current all these 20 years.
Wow. Yeah, there's a few things in healthcare is a team.
Absolutely.
And there's physicians, nurses, environmental services, dietitians, physical therapists. It takes a lot of people in a hospital to maximize people's potential for health.
Oh, absolutely. It takes all of that.
It takes all of us, and nursing is such a key role in that, and such a key impactful role at the bedside.
Yes, and one thing that has always made a big difference is, yes, we're all part of the team, but nurses are who are with the patient 12 hours a day. They can get any little nuance to know that if a patient's really turning a corner and doing well and can go home sooner, or if the patient is turning that other corner and getting sicker, and calling those rapid responses before something terrible happens, or just really keeping a good eyeball on the patient to know what way their care is going. They're the first eyes and ears that the doctor hears to make those decisions, whether good or bad.
What just kind of changing the subject a little bit, as working with Dr. Durham in the cardiology clinic, what would be some advice that you would give to patients coming in to see the cardiologist the first time? If you were to have one piece of advice of every patient that's going to come see the cardiologist, what would you tell them?
I would tell them just to come, be prepared to be open and honest about everything that's going on with them. Something that maybe they do not think is significant to their care, cardiology-wise, could actually mean a big difference in what we find is going on with them. Like they're not sleeping well at night. Well, are you not sleeping well at night because you can't lay flat to sleep? That could be an indicator that you have heart failure. It's the little things that actually make up the bigger picture when we're trying to take care of someone.
So just as a patient, being very open, very honest with the doctors and nurses really improves care.
Oh, 100%.
Absolutely. Well, thank you so much for your time this morning, and I'm just excited that we got to spend this time together.
Yeah, thank
you.
And
if you have any questions that you would like for us to discuss in our videos with other teammates, just leave a comment in the comment section.